So 2 years ago, I got a letter from Blue Cross Blue Shield that made my stomach drop like you're on a roller coaster. Your practice has been selected for a remote therapeutic monitoring billing audit, right? And I'm not gonna lie, I was terrified. It was new for us. This was early in the RTM program. I was thinking like, what are we gonna do? What if we've been, doing something wrong? What if they deny all of our claims? What if what if we owe back, tens of thousands of dollars? And of course, nobody wants to go through that, right? That's like the practice's worst nightmare. But what actually happened was the opposite of what I feared. And not only did we pass this audit with flying colors, but the insurance company actually asked me to train their auditors on how RTM actually works. This was back in 2023. My name's Dr. Andrew Grecki. I'm a physical therapist. I'm the owner of MovementRX. And I want to let you know exactly what happened and what it means for your practice, me going through this audit and the experiences that I had. So I'm going to set the scene for you, right? So it's back in November of 2022. We had been doing RTM for about 7 or 8 months. It was brand new. And we had 180 patients that were enrolled in the program, right? So, I open the mail, I see this Blue Cross Blue Shield letterhead, not a good feeling. To say the least, right? So the letter says, your practice has been selected for this routine audit, routine, of course, right? And it was all about the remote, therapeutic monitoring CPT codes. I think it had all of them listed, right? The 98975 and the 98980. And it was from periods from March 2022 to October 2022. So like it was just a few months into when we were doing this. And so I was thinking, oh my gosh, they wanted 25 patients, I believe it was, and they gave us 30 days to give them the information, right? So they wanted, initial patient consent forms, set up an education document, device supply records, daily monitoring showing there was 16 days of data in a month, time logs for all the monitoring activities, communication records with patients, clinical notes from the treating therapist, all the things that you need, right? And my first reaction was panic because 25 patients is a ton. We'd never gone through this before. 8 months of data and hundreds of pages of documentation. What if we missed something, right? This is so new. We were kind of doing this, trying to learn as we go. And so what if our documentation wasn't good enough? What if we interpreted the billing rules wrong? Then my second reaction was, okay, I'm determined. This is valuable to the patient. We're already helping other practices do this. So I thought, you know what? We did this right. We documented everything. We've asked all the experts and we're following the rules. We've got FDA clearance. So let's just show them, right? So I called our team together and I said, we're going to treat this like an audit, like it's like a final exam, right? We're going to show them exactly how RTM should be done and everything that we have. And so let me walk you through exactly what we had to document for this audit, right? So this is important because it shows, what you need to be tracking if you're implementing RTM and to do it successfully. And so for each of the 25 patients that we provided to them, we had to show them, was there consent? Was it verbal? Was it written? Was there education and setup, right? Because we built this 98975 code, right? So we had to prove that we, the patient agreed to it. We educated them about it. We set it up on their mobile device. We explained how RTM is and how it works. And then, we documented the time and the date that this occurred. Again, this was all done in our software that we have at MovementRX, which is great. So that's easy. The software did that for us. And we had to show that there was consent, not only verbally, but also we have a document that the patient signs in the plan of care when they were first meeting somebody. We had to demonstrate that we had initial education that was in our documentation. And so we gave all that to them, right, to prove that this is what we did. And we were at the same time, this is our own software, so we needed to make sure it was correct for everybody else that we're working with, right? So we provided that patient, with the device. We were tracking their exercises. We set it up. All this documentation needed to support that, and that we had to ensure that the patient could access it and that they actually did. So what we provided was the patient login credentials and the setup date. We provided the log of the patient exercises. Again, our software does all this automatically, so that was the easy part. We had confirmation the patient logged in. Every day there was data collection. So of the 16 days at the time, now it's 2, but that was a big part of it, is that we had to prove that the patient was actually using the system and that they had access to it for at least 16 days in a month. And our software, again, does that for you. And so we provided, though, that in our system there's a download all patient activity, right? So we have that document. It's got daily engagement reports, exercise completion data. It's got who did what from a provider standpoint. All the stuff is logged. What days there was data on the specific day that the patient engaged, and what did they engage? Did they log their pain? Did they watch a video? Did they have steps that we were tracking? Did they chat back and forth? And then we had to show that the timed codes reached the 20-minute threshold. The provider actually did monitoring, and what was done during the monitoring, right? We had to prove that there was at least 20 minutes of time spent. That they were reviewing patient data, they were communicating with the patient, they were documenting their findings, and so we provided them again that downloadable document that our system produces automatically. It saves all this. That was all in there. So it was literally a click of a button. It had all the time logs, all the dates and the times of all the monitoring, what the duration of the phone call that's required each month, how much time was spent on that, and then any communication between the therapist and the remote provider, the recordings of the calls, when the calls happened, documentation notes from each monitoring session, right? Message exchanges between the patient. They can chat in our portal on our software. And again, the app, our software does all that automatically. So we were able to easily get that to the reviewers, right? Which is awesome. And so that made me feel better, right? So we've got all these things. So we felt good about it, right? And it's all there. And so we had that. We had communication, with the treating therapist, 3 minutes here on this date. And, so again, we document every minute of everything that happens, and that all stays in our system, right? And so we also were able to show that there's clinical integration, meaning, we provided, even though they didn't exactly ask for that, we provided everything we had. So all the notes from the treating therapist showed they reviewed the data. It was in the plan of care. The plan of care, when the patient was evaluated, had information about, the plan, the duration of how long they're going to be doing RTM, why they're doing it, and what are the goals with that. And so we submitted all that documentation, and here's what happened, right? So week one, we get this initial review. The auditor called and said, we've received your information, right? Pretty standard. We're reviewing it, and we might have some follow-up questions, but we'll get back in touch with you, right? And so, of course, I said I'm available anytime you want. So that was, I guess, the first week. Second week, there was some follow-up questions, right? The auditor called back, and they had some specific questions, right? So question number one was, I think, for the 98977, the monthly device supply code, you're billing for data collection, right? But the patient isn't wearing a device. How are you collecting that data? Well, my answer is the patient is using our app, right? They log exercises completion and all the other things that we're tracking, and the app is tracking that whether they did their exercises or, how many repetitions and was there any pain, was there difficulty that they were experiencing? That's the data we're collecting. And the auditor didn't even know that. And in fact, the CPT code for that doesn't require a wearable device. It actually doesn't allow a wearable device, right? It requires a software as a medical device that collects data, therapeutic data, right? And so the auditor's like, okay, well, that makes sense. I wasn't sure if there was, the app counted it or what. That's a common misconception. They don't know, right? So they didn't know that it needed to be a wearable, or that it can't be a wearable device, right? Another question they had was on the time. So the 20 minutes of monitoring that's required, are you including time spent communicating with the treating therapist? Is that allowed, right? Well, yeah, that's allowed. That's part of this. Is it's a communication system, right? And the CPT code actually describes that as treatment management services, which includes, coordinating with the treating provider. And, we're not just calling the patient and hanging up. We're integrating the monitoring data into the overall plan of care, right? And so the auditor is like, oh, that's a good point. So again, showing that they don't really have knowledge of what they're actually auditing. Another one they wanted us to explain was the consent process. Like, how do you ensure your patients understand, what they're agreeing to? Well, we really have two things that we do. And so I explained that the first is the therapist is explaining it when they're evaluating the patient, and they actually install the app with them. And when the patient then clicks to log in, that is the consent form. And not to mention, we also, so we get that verbal consent, and then we get them to actually log in, and that is the consent, and it shows that in our software. So explaining all that to them. They had the records, but they didn't know where to look, right? So, and then we're also like, not just consent, but we're also explaining like, is there a potential out-of-pocket cost? Like, you know, we go through a thorough process. And so the auditor agreed, like, oh, that's pretty thorough. And, you know, most practices have a paper form. Well, no, they don't. This isn't a paper system. This is a technology system, right? And so I thought that was kind of interesting. And then week 3, so the auditor called me and said, you know what, Dr. Grecki, I've completed my review of your 25 patients. They actually interviewed the patients too, by the way, in their homes, which I think is insane. And they had good news, right? They said, you know what, all 25 patients passed the audit. Your patients are very happy and your documentation was excellent. You clearly understand, you know, the topic and you're doing things well. You know, you're providing all these legitimate clinical services and, you know, they said to me, this is kind of interesting. This is one of the first RTM audits we've conducted, right? So I was like one of the first people in Michigan. And since it's new, frankly, they said their team doesn't fully understand how it works and what we should be looking for. And, you know, our documentation was so thorough that it actually helped us understand. That's what they told me. It helped them understand what RTM, what it's supposed to look like. And then the crazy thing happened. She asked, would you be willing to do a training session for our audit team? And I was like blown away. They wanted to learn, you know, from practices that are doing it properly. I had told them I'd spoke a few times at the private practice section on this topic. And, you know, so they wanted us to actually help them. I was like literally stunned. You know, not only did we pass the audit, but they were actually asking me to help them. And of course I would said, yes, I would do that. But it really just goes to show you that, you know, as long as you have a good software and you're doing things properly with your documentation on your plan of care, like it's going to go well for you. And 2 weeks later, you know, we did a 90-minute Zoom call with Blue Cross and you know, their audit team, you know, went through, you know, questions that I had, and I tried to train them on, you know, a couple different pieces, like what is RTM actually? I explained it to them and how it's different from remote patient monitoring, which they're somewhat familiar with, and how remote therapeutic monitoring is for monitoring therapeutic activities like exercise and rehab, and it's designed to improve patient compliance and with their own programs that the physical therapist or the occupational therapist creates. It's clinically viable, not just a billing opportunity. And then I went into like what does good documentation look like and where it should be, you know, where the consent is, where the data collection lives, you know, how the time is supposed to be tracked and logged, and how there's supposed to be a phone call that's made, and how that's supposed to be integrated with clinical care. We went through, you know, what does it look like, what to look for in an audit, like what are some red flags. It's things like no evidence of patient consent, you know, billing for patients who aren't using the system, so there's no data being collected. That's a big one. If there's no data transmission, that's not great. Billing for monitoring time that didn't actually occur. No clinical integration, meaning they were just checking boxes to bill codes. You know, and so that helped them, I think, understanding that the phone call is important. You know, that there's got to be clear consent, clear patient engagement, documented, you know, the monitoring times and the activities that are occurring in the time logs. Communication between the remote, you know, person who made the call and the treating therapist, and how important that is, and how clinical notes, you know, showing that there was RTM data that influenced that treatment plan. And some common misconceptions I try to teach them about was like, there's, you know, you don't need a wearable device, you don't need EMR integration, right? The monitoring can be done by remote, but they have to be licensed providers. And the 20 minutes that happens, you know, needs to include not only reviewing, communication, and documentation, but there needs to be an actual two-way audio communication with the patient, right? And so at the end of all this, you know, the training, the audit director said, you know, thank you for this. You've helped us, you know, understand this more than anybody else internally. This is new for us. They also asked for our outcomes to prove this makes a difference, and we did actually have some engagement outcomes and some functional score outcomes to show them, so they were very impressed with that. And they said they're going to use our practice as a model when they're auditing other people. So that was one of the proudest moments I've had. And it also relieved a ton of anxiety that I had as well. So not just because we passed the audit, but because we helped shape how insurance companies are understanding and evaluating RTM. The first year of RTM, Blue Cross of Michigan had a required manual medical review for every single claim. They got rid of that after our audit, which is cool. So what does it mean for you, I guess? Well, I think what you should take away from this story is that, you know, audits are scary, but they're not scary if you're doing it right? If you've got a team of people like us to help you, you're getting proper consent, your documentation. And this is all about, by the way, this is all in training. When you work with an RTM vendor, they need to train you on all this, like what's required. And I can tell you a lot of these big corporations or the EMR companies that have RTM software, they're not doing that. So you got to make sure you're training good and you got a good company like us to help you. You also realize insurance companies are still learning about RTM, right? This is a new billing category. Even the auditors usually the auditors are a nurse, right? They don't even know what they're doing. And so they're looking for obviously fraudulent things. They're not nitpicking details, but you can show that you're providing legitimate clinical services, right? You don't need to be scared of this. Good documentation is your best defense. The documentation for RTM lives in our software as it should. There's very little documentation you need to have in your clinical notes except for on the plan of care. And you have to realize, like most practices aren't, they're not documented properly. The auditor even told me that there's a ton of incomplete stuff. There's no proof of data. There's very vague time logs. There's no integration with clinical care, and so, that's why they're failing audits is because they're not being trained properly by the vendor or the EMR company that's got them on board with RTM, right? So you can't be sloppy here. You got to make sure you're doing it right. I think another lesson is you got to work with experts, right? You should work with experts like me and our team who pass these audits, right? It's not just software, right? There's a whole element here of properly doing this and tracking things and documenting and making sure your remote providers know, how to do this the right way. And so you need a system that's designed for compliance. And if you're doing this on your own with spreadsheets and guesswork, you're at a much higher risk. And also, if you're doing it with a vendor that doesn't train you on all these things, I think you're at risk too. They don't have any skin in the game. It's all on you as the provider. You need to realize the insurance companies want you to succeed, right? This helps the patient, which I think is surprising, but they want you to succeed. They want you to know, how to do this the right way. So it leads to better outcomes. But if you're doing it wrong, it's going to lead to worse outcomes and higher costs. And RTM actually, can go bad if you don't do it right. Right, so you got to keep that in mind. They want you to do well. This is like an incentive. They're incentivizing you by paying you to do this so that the patient has better outcomes. But again, if you're not doing it properly, you're putting yourself at risk. So if you're implementing RTM and you need to understand how to pass an audit, what's right. So I'll give you a couple of quick steps. Right, you got to use the right software. You got to don't try to track this manually. That's ridiculous. It's not going to work. You need software that's capturing patient consent digitally. You need software that's tracking daily patient engagement automatically, right? It's logging, monitoring time with timestamps. It's storing all this information, this communication with the patients. It's generating audit logs, right? You need to be able to document everything for every patient every month. You should be able to produce consent forms and 16 days of data transmission and 20-minute records of time and all the communication records, all the home exercise program lists of things you created, and that should be integrated with your clinical notes, right? And you got to train your staff. So step 3 is you got to train your staff, right? Everyone involved with RTM needs to understand like what can and can't be billed, how to document properly, what's required on the plan of care, what's the time requirements, how are you going to integrate this with your clinical decision making, that's important. Step 4 is they need to do internal audits on your own stuff, right? We do them quarterly. So we pull 5 random patients, we audit our own documentation, and you need to ask, like, if the insurance company requested this, would we pass this or not? Create an audit. Actually, I have one for you. I've got an audit checklist for you that I'm going to give to you in this video, so that'll help. And then you got to work with people who've been audited before, like us. We've been through this. We know, we're there to help you if it happens to you in the future. I can tell you these big private equity firms that are out there integrated with your EMR or your EMR company, they're not going to do that for you. They're going to back away immediately. It's not our responsibility. It's your responsibility. You're the provider. So you got to work through this with people that actually care, providers, right? People that are doing this in their own practice like me. And so if you're worried about compliance and audits, I get it, but it's a legitimate concern. But don't let that stop you from actually implementing this to help your patients do better. And so here's what I want you to know, this final kind of takeaway is that when RTM's done right, audits aren't scary. They're just paperwork. So I put together a complete compliance checklist for you that shows you exactly what you need in your document, your documentation to pass that audit, what to look for in an RTM software or a vendor, what's required for each CPT code. I put that together for you so you can not have to guess, right? Even sample consent forms and time tracking templates and all that stuff, right? And so all the questions that I get from other practices and the auditors. I put that together, red flags to look for, so you don't have to guess, right? And you can download it for free. It's super easy. The link's going to be right under this video. It's called the RTM Compliance and Audit Checklist. And if you want to talk more about ensuring that you're compliant and that you're having a good experience with RTM, you can simply book a 15-minute call with me. And I hope you enjoyed this video as much as I enjoyed making it, and we'll talk next time.